Hello, I'm Dr. Mark Dailey, and thank you for taking a moment to watch this video. If you suffer from a chronic condition like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, Crohn's disease, arthritis, or even an autoimmune condition, the information I'm about to share is vital. Again, if you've been suffering from a chronic condition, no doubt you've been passed from one doctor to the other with very little results. The reason is the modern medical approach is the suppression of symptoms, not the resolution of the cause of those symptoms. I am a doctor of chiropractic that graduated from Functional Medicine University and have advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, as well as mastering the thyroid, as taught by Dr. Dailey. If you'll give me 5 minutes of your time, I'll explain why functional medicine has such a high success rate with chronically ill patients and how you can benefit from this fresh new approach. How many times has your doctor offered to partner with you? Well, as a functional medicine patient, you become an active partner with your healthcare specialist. This allows you to really be in charge of improving your own health and changing the outcome of your illness. I take you by the hand and lead you on the path to wellness. Most physicians are trained to heal acute conditions like a broken arm or appendicitis. Conversely, as a functional medicine practitioner, we spend time with you. We listen to your histories and evaluate your history and determine what genetic or environmental lifestyle factors may be affecting your immediate and long-term health. As your functional medicine practitioner, I address the underlying cause of your illness, not just the symptoms. So you might ask, how does the assessment work? Well, if you think of your body as a fish tank, if the water in the fish tank becomes polluted, the fish becomes sick and may even die. Now imagine your cells and your organs as a fish and your body as a tank. Well, if not properly cared for, the internal fluids within your tank or your body become polluted, resulting in an unhealthy environment in which your cells and your organs swim. Well, functional medicine, or the functional medicine assessment, utilizes urine and saliva, stool and blood to analyze how nutrients and other elements are moving through your body. Saliva, for instance, is used because it provides an overall picture of the body's internal cellular environment. Urine represents what's being filtered by removed by the body. Stool gives me an idea what the environment of your gastrointestinal tract is like. By comparing these many tests, we can clearly see just how healthy or how polluted your tank is. We then customize a specific plan to each patient. The health recovery program that I have designed is second to none. The support and educational process is extremely comprehensive. We meet in person every 2 weeks for a 4-month period. We talk on the phone the weeks that you don't come in. We have email communication if necessary. You receive at least 2 or 3 educational videos each week specifically tailored for where you're at in the program. These are videos that you can watch at any time, anywhere. You can save the video links and watch it again and again. As of right now, we have in excess of 16 hours of educational material. I'll educate you on all the testing available, what kind of information we get from each test, how it relates to your specific condition. We'll talk about gastrointestinal function, and I have to say almost everyone with a chronic condition has some form of gastrointestinal abnormality. We talk about the things that go wrong in the gastrointestinal tract, from parasites, yeast overgrowth, fungal infections, opportunistic bacterial overgrowth like H. pylori. I'll explain why bacterial dysbiosis causes a laundry list of symptoms that you probably suffer from. We'll talk about adrenal and thyroid function and how it relates to chronic conditions. That may not seem all that interesting to you right now, but when you get your test results and find out that you actually have several of these things going on inside you, your interest level will certainly rise. We give you a progressive binder that contains all of your test results, your written plans, supportive material for your specific issue, and 8 different audio CDs designed to educate and encourage. Functional medicine addresses the underlying cause of disease using a systems-oriented approach and engaging both patient and practitioner in a therapeutic partnership. It's an evolution in the practice of healthcare that better addresses the healthcare needs of the 21st century by shifting the traditional disease-centered focus of medical practice or healthcare practice to a more specific patient-oriented approach. Functional medicine addresses the whole person, not just an isolated set of symptoms. If you are tired of being sick and you're ready for a fresh new approach, I'm going to offer you a complimentary initial consultation that would normally cost in excess of $275. Also, I'd like to offer you my free course on gastrointestinal function, the key to wellness. Simply give us your name and your email address, and that will be delivered to you immediately. And of course, that email address will not be shared with anyone. On this web page, there are real patient testimonials, people who have been through my program and been under my care. These are people just like you with real problems, and they got better with functional medicine. At this point, let me suggest you do 2 things. First of all, sign up for the free course. Second, call my office and schedule your free consultation. I want to thank you so much for your time and your attention. God bless you, and I wish you the very best of health.